is that you can't do this company by company. That's why Safeway supported the Affordable Care Act. You need to do this for our whole society. Healthcare costs are far too high. We've had hyperinflation. There are ways to change the payment system, which would, and there are elements of the Affordable Care Act that move in this direction that would encourage primary care, preventive care, chronic disease management, things that you would do to save money before people get to the expensive specialists. We have a system that has great specialty care, best in the world. The problem is we have too many people getting to specialty care who don't even need it, who we could keep well. Either stop them getting ill in the first place with good primary care, good nursing, or manage the disease if you have obesity, diabetes, hypertension, etc. And the Affordable Care Act moves in that direction to bend the cost curve, which is crucial. That's what we're going to need to afford employer-based health care, Medicare, and Medicaid. We don't have a problem. We're talking about not having Medicare as we've known it in this country only because of healthcare hyperinflation, not because of any fundamental problem in the system. The Affordable Care Act moved towards changing that system. So I think I think it's the responsible thing to do is to move forward with this reform, make sure that there is an end to discrimination, that everyone has someplace to go to get health care, no matter what, and they can control their own healthcare decisions, work on improving it, implementing it well in the state of Wisconsin, adapting it to Wisconsin. Right now, we're not designing a Wisconsin health insurance exchange for political reasons. When in fact, other states are doing so, we should be figuring out how to make it work best in Wisconsin because that's the responsible thing to do. And we can use a lot of the ideas that Quadgraphic, Seriograph, others have had in this comprehensive system. And these individual companies aren't going to do it on their own, though a lot of them have done things that are helpful in figuring out how to reform this system going forward. But I think we start by saying that we're all in this together. We are going to make a commitment to make sure that health care is available for everyone who needs it at an affordable level so that you can, in fact, on responsibility, not only the responsibility to be well, but the responsibility to buy insurance. We just had a big debate in this country about whether people who are, when insurance is made affordable to them, whether they should be required to buy insurance. And when they don't do that, what happens is they're telling everyone else, if I'm in an accident, if I get sick, I end up in the hospital, you're going to pay. The Affordable Care Act says that's irresponsible. If we make it affordable for you, you have to do your part to be responsible. So that's a fundamental element here, but I think as a democracy we need to be responsible for changing the rules of the road here and creating a fair system that works for everyone.
This is always the hard part, trying to review. I think what you said, effectively you said it was okay that there are a lot of rules that come along with this because we're recreating a large portion of our economy. It's a complex area. So you'd be surprised, I think, if it didn't take a lot of language to accomplish it. You said that the wellness could be expanded. Maybe we should spend more money on that area of this. You said we have too many people who are getting specialty care because they're getting to specialists when maybe if we did more on the front end with primary care and some preventative care, we could reduce the need for some of that specialty care. You said that Medicare is failing because of hyperinflation in medical costs. And then finally, you said we should be building an exchange. You actually said something else, but I couldn't keep up. You said we should be building an exchange here in Wisconsin. And so there's a number of things that I want to respond to that. As far as an exchange, I think that it's when you look at it, and I think that what was said a little earlier, the idea that some of us don't think we really had this debate in the proper order, and I think that a lot of the we're trying to keep this apolitical, but I think right now we're having an election where part of this election is about should we proceed down this path. We have a presidential candidate who has said he would grant a waiver for affordable care to every state the day after he's elected. So Mitt Romney has said he's not going to follow that path. And so we are right now having an election about this. And so there was a political decision to say we're not going to move forward until the nation has this debate as part of this election, and then we will move forward. Secondly, we talked about the idea that Medicare is failing because of hyperinflation. Medicare is a system that is going to fail on the path that we're on. But I think that we've got to address how we structure that program, and many of the elements that are driving that are the way that we have paid for healthcare in the past. We have a system that was designed in the 1950s, 60s, and it paid fee for service. And you have providers who work on a system that it's all about delivering specific services rather than saying, let's focus on outcomes. We have a lot of reforms going on in Wisconsin right now that insurers and providers are working to say, how can we start paying for outcomes? I briefly served on the board of the UW Hospital clinics in Madison. And one of the things that I learned there was that they do one of the most complicated surgeries in the country, a heart-lung transplant. And they do that surgery so well that their patients are in the hospital about 15 days. The national average is 55 days. And what that says is that if you do a high level of quality, you can drive down costs. So I think, what we need to do is we need to say to hospitals and providers that we need to focus on high quality outcomes, and that's what we're going to pay for. We're not going to pay if you're having somebody who's coming back in because there's infections and other problems that are going on. And what I see is an industry and both insurance and providers that are saying we're going to work to get the better answers in those kind of questions. We may end up, I think that the market working on these issues can get us to better outcomes and lower costs at the same time. It can be done. We talked about the wellness element being expanded. And when I look at wellness, it's not so much a grant. It's a way of encouraging people to participate in that wellness. I like the idea of primary care being more of a focus. I think that if we do more on that front end, I believe you're right. And so I think we need to have primary caregivers and providers that are engaged in helping to maintain the wellness of their clients. And I think that's something else that's already happening in the marketplace, but I believe it's something that we can do more of. The only thing, when we talk about the rules, that's the last thing I came to, is right now your health insurance is regulated in the state of Wisconsin. Under the Affordable Care Act, that regulation goes to the federal government. And that's why they have to create 40,000 pages of rules that they've never had before. And instead of, people here in Wisconsin, our insurance commission, our providers here, dealing with those issues at a state level, it's going to happen at another level that's beyond our reach in many ways. And that's concerning to me. Like I say, the federal government can build a tremendously complicated system here, and it's not going to be as accessible either to our providers or to people here within our state, and that's something I'm very concerned about. So I like the idea of Wisconsin, who I think has been a leader in healthcare and in reform, having the ability to lead these issues closer here to people where it can be much more responsive. I always believe that we're better off the closer government regulation is to the people that are regulated.
Now we're going to turn it over to the audience.
Well, Representative Stone started with the politics and the debate around this bill, and mentioned that Governor Romney would offer a waiver immediately to states that we should move forward only after we have an election. That insurers and providers want to pay for quality outcomes. That sort of a high level of quality can drive down costs, and wellness should be done by primary care doctors at settings where we interact with doctors. And the rules should happen at the local level, as close to the people as possible. But I would say on the idea of Governor Romney, if he were President Romney offering a waiver, that he needs to read the law. He's not able to, if the law is still in place, if he doesn't have veto-proof majorities in Congress, he won't be able to offer a waiver.